A New York City jury has found a hospital guilty of $120 million in damages. For those who don't know, I'm Dr. Hassan, board-certified trauma anesthesiologist. In the case of Robert Lee, a New York City court has ordered that the hospital Westchester Medical Center pay $120 million for a misdiagnosis of a basilar artery stroke. Before we get into the story, it's wild. A basilar artery stroke. A basilar artery is in the back of your brain. It provides oxygen and blood to the parts of your brain that not only control speech, ability to swallow, but the ability to smile and the ability to talk. Now, this stroke occurred at about 3 a.m. back in 2018 when William Lee was brought to the hospital because he was thought to be having a stroke. And the CT scan was read by a resident, not by a board-certified trained radiologist. The resident read the results as clean. However, William Lee's symptoms did not improve with treatment, and he was complaining of a severe headache. About 3 hours later in the morning, so William Lee came in about 3 a.m., he had the scan about 4 a.m., and about 7 a.m. in the morning, a board-certified radiologist read the results, immediately called the ER doctors. He immediately went to surgery. However, it was too late. The brain tissue had already been deoxygenated for too long of a period. Because of this, the family said that the patient is unable to be a father, a husband, and a part of the community anymore. And the family was awarded $120 million in this lawsuit. The reason why this hits home is because residents are not fully trained doctors, and the hospital not only had a resident covering overnight, but they were also covering the emergency room. In the emergency room, you and I both know that all sorts of people come in with all sorts of symptoms, and ER doctors are overburdened as it is. Unfortunately for this resident, obviously they were not up to the task and they missed the diagnosis. And unfortunately for the patient, it gave permanent lasting damages. This is also a massive lawsuit in the form of $120 million, but the reason why this is bigger is because medical hospitals and community hospitals and hospitals across the country are not going to be able to just leave residents by themselves if there are catastrophic results. As an attending physician now, I can pinpoint when it's a resident doing the work or when it's the active surgeon doing the work or the active attending doing the work in the realm of surgery, but also on the floors when it has to do with residents versus attending. And now this is going to set a precedent for the future. Residents are not given the same degree or level of autonomy, but it also might be safer for the patients. It's a weird dichotomy. I'm not entirely sure where I fall on the spectrum, if residents should have more autonomy or should have less autonomy, because we do have to train our doctors, but we also have to be safe about it. And hospitals are under pressure as far as budgets go, and they have to cut costs. And if having a resident overnight moonlight is a way to save a couple $1,000 on this side or that side every single day, it's a very tough situation. I don't have a right answer for it. There's a lot of moving parts. Obviously, the residents need education. Obviously, it's a business. And obviously, there's a patient in the middle who has more pull. Because without money, there's no treatment for the patient and there's no training for the resident. But without time, there's no resident that can get trained. And without a patient, neither of these two exist either. So be able to find a happy medium, I don't know what that is, but this is a landmark trial that's probably going to set the precedent for other future medical malpractice trials going forward. What do you think? What's your opinion? Where do you fall on the spectrum? I don't know where to fall. Tell me. Appreciate you guys tuning in. Do me a favor. It's 10:40 at night. I try to record these things very late at night. I try to put my heart and soul into them, as much of my heart and soul that's left over after a 12-hour day going to the gym and hanging out with my son. So if you can, I really appreciate it. If you can like, subscribe, and share this thing, because I'm trying to grow this channel for you and for me and for everybody else to make the world a better place. Love you guys. See you on the next one.